board and say welcome to this presentation about Medicare, and I will turn it over to Amanda from Trellis, who partners with Senior Linkage Line to bring us this information.
Wonderful. Thank you so much, Anne. My name is Amanda. I'm a community outreach specialist with Trellis, as Anne mentioned, and looking forward to talking to you today about upcoming changes in Medicare. We'll also do a little bit of a brief overview of Medicare as well, a couple of the different parts of Medicare, just so we can understand the options and the changes that are coming up. So I'm going to go ahead and share my screen here.
Let me make sure you can do that. Oh,
I can, yes. Let's see. Beginning. Okay. So it's hard to believe we're heading into 2023 already, but you know, here we are. And we are talking today about Medicare open enrollment. I'll explain a little bit more about open enrollment. But first, I just want to tell you a little bit about Senior Linkage Line. Senior Linkage Line is a really great resource as you are navigating Medicare and reviewing plan options, reviewing changes. So I just want to make sure that you know that Senior Linkage Line is a resource that's available. So we are a free service. So we are funded through state and federal dollars. We partner with the Minnesota Board on Aging to provide this free service. You know, we give information, assistance, resources to older adults, families, caregivers. You don't have to be a certain age to call the Senior Linkage Line. Anybody can call. We are neutral, so we don't recommend one service or provider over another. We want to give you all the options and help you decide what's going to work best for you. So, you know, in terms of Medicare options, you know, it's a really great resource because we're not trying to sell or endorse one plan over the other. We're really just giving you all of the options that are going to be best for your situation. And we're objective, so we're going to give you all that information. You know, Medicare Advantage plans have over 100 plans in Minnesota. So we're going to start with all those 100 plans and help you whittle them down to, you know, let's say 5 or 6 plans that are going to work best for you. Okay. So it's a really great resource. And, you know, we also have some Medicare counseling options available as well that are completely free, neutral, unbiased. You can call us 800-333-2433 Monday through Friday, 8 to 4:30. You can also visit our website, mn.gov/Senior Linkage Line, or you can also utilize the chat option on minnesotahelp.info. So there's a variety of ways to connect with us at the Senior Linkage Line.
And I will send those out. And actually, I should say that Amanda was generous enough to leave the slides, and I will send those to those who are here.
Perfect. So you don't have to be scrambling with your pen here. You'll get the slides. Thank you, Anne. I just wanted to share too some print materials. So if you're looking for more resources, these are really great resources that Senior Linkage Line can send to you for free. The one that I want to highlight the most is that one in the middle there. That's the healthcare choices for Minnesotans on Medicare. I do not believe the 2023 version is out yet, but you will be able to view that on Minnesota. It's mnhealthcarechoices.com is where you can view that and download a PDF copy. So this is a comprehensive overview of all plans in Minnesota. So this is going to give you the details of those plans and is a very thick booklet. It's about 200, at least 200 pages. So it has a lot of reading material in there, but you know, if there are certain areas of the book you'd like printed, Senior Linkage Line can gladly do that for you. We do not, unfortunately, do not give out hard copies of these anymore. They just don't print them anymore. So how we get around that is we can print you a section of the booklet if there is a need for that. Again, I mentioned our website, mn.gov/senior linkage line. You can view those resources on this website or request those resources on this website. Just another really great resource. Now I want to show you this. I'm going to leave this up here for just a second here. A little disclaimer. Today, we do not have the new premiums or deductibles for Medicare 2023 yet. They haven't been released to us yet. So if you are interested in getting those as soon as we get them, this QR code here will lead you to a forms page where you can put in your name and your email, and we will send you those updates as soon as we get them. So again, that's the premiums for Medicare parts A and B and D, and also deductibles for A, B, and D. So again, don't have them yet, but we will be happy to share those as soon as we get them. So feel free to take a picture of this QR code, and that will lead you to that forms page. All right. And of course, I have to give a little plug about volunteer opportunities. We have some wonderful volunteers with the Senior Linkage Line and Trellis who do a lot of work with us, especially when it comes to Medicare. We have some volunteers who are Medicare counselors who really help with those plan options and plan review. So if that's something that's your wheelhouse and you would like to volunteer with us, let us know. We don't only have Medicare volunteers. We have volunteers who do other things for us as well. So give us a call if you're interested. We would be happy to have you on board. Okay. So we're here today to talk about Medicare and the changes that are coming up for 2023. Now, starting on October 15th, so it's coming soon, Medicare open enrollment will be starting. So October 15th through December 7th, you can make any changes on your plan. So during this time, it's going to be important to review any changes that come in your plan. So if you are on a Medicare plan, that information will come through the mail, and you're going to want to review that carefully. Even if you think your plan is working well for you, you want to make sure that there's no changes that are going to affect you. So changes in premiums, changes in provider networks. You can see here on this slide that plans can make these changes every year. So they can change their premiums, deductibles, not necessarily meaning that your premiums and deductibles are going to go up. Sometimes they go down, which is always a good thing, but they do go up as well. Your network of providers could change, covered medications or restrictions, out-of-pocket costs, covered benefits and restrictions in your plan coverage area are all things that can change from year to year. So you want to make sure to do that annual review of your plan during this time. Now you can make changes, so you can enroll in a different plan. You can switch from Medicare Advantage to original Medicare or vice versa. And any changes that you make go into effect January 1st. Okay, so anytime during this open enrollment period, make those changes. It starts January 1st. As I said, you can decide to, if you have original Medicare, and we'll talk a little bit about what that is in a minute, you can decide to join a Medicare Advantage plan, join, drop, or change your prescription drug plan, or stay with original Medicare. You do not have to make any changes during this open enrollment period. If you're on a Medicare Advantage, same thing. You can change to a different Medicare Advantage plan. You can switch to original Medicare with or without that prescription drug plan, or you can stay with your current Medicare Advantage plan. Okay, again, don't have to make changes. Cost plan. So if you are somebody who is in an area that has a cost plan, so none of the metro area counties in Minnesota have cost plans, but many other counties, 21 counties in Minnesota do have those cost plans. Same thing, you can change cost plan, so move to a different cost plan, or you can switch to original Medicare or Medicare Advantage. So you have some flexibility during this time to make changes. Okay, so because you're attending this presentation and most likely already on Medicare, you probably know a little bit about the different plan options, but I do want to do a quick overview of what those options are, just so we can be sure to that everybody understands the options that we're talking about as we're going through the changes for the upcoming year. So when we have options for Medicare, there's two main options. We have Original Medicare, which is Medicare Part A, which is your hospital insurance. That covers inpatient hospital stays, hospice care, skilled nursing care, home health care. And then Part B is your medical insurance. That's what's going to cover outpatient hospital care, diagnostic tests and shots, therapies, and some prescription drugs. Part A and B together are what's known as Original Medicare. Now, once your deductible is met, Original Medicare still does not cover at 100%. So there is about 20% that you are responsible for out-of-pocket costs. For that reason, there are optional coverages with Original Medicare. You can purchase a Medigap policy, which is a supplemental policy to help pay those out-of-pocket costs. Medigap policies are standardized, so they're sold through different private insurance companies, but no matter which one you get it from, they're going to offer the same coverage. The difference is going to be within premiums and level of customer service. Okay, so you still kind of want to do some shopping around to make sure you have a good Medigap policy. The other optional coverage is a Medicare Part D, which is your prescription drug plan. Now, this is an optional coverage. However, if you don't enroll in a Part D plan when you first become eligible, you may incur some penalties if later down the line you are going to be enrolling in a prescription drug plan. So that's just something to keep in mind. So that's the first option, Original Medicare. Then there's kind of these bundle plans. So option 2, these are Medicare health plans. That's the Medicare Advantage plan, also known as Part C. So this combines Part A, Part B, sometimes Part D, so sometimes has prescription drug coverage, and can offer some additional benefits. Okay, so these would be things that Original Medicare does not cover. Things like vision, routine dental care, eyeglasses, transportation, hearing aids, things like that. Depends on the plan, though. So different plans can offer different benefits. One thing to note is that if you do enroll in a Medicare Advantage plan, you are still paying that premium for Medicare Part B. Okay, so you're paying that premium in addition to the Part B premium. I talked a little bit about the cost plan. So that's similar to a Medicare Advantage plan, combines the different parts of Medicare. One main difference is that with a cost plan, if you go outside of your network, Original Medicare will pay. With a Medicare Advantage plan, Original Medicare is not going to cover any of your costs. So once you enroll in the plan, that plan is now the payer of your services, not Original Medicare. So if you go outside of network, you're going to be ending up paying up to 100% of your costs. Okay, so a lot more than you would if you were within network. With a cost plan, you can also decide to have a separate Part D plan. With a Medicare Advantage plan, you have to take the Part D that comes with the plan. And if it does not come with that Part D prescription drug coverage, you cannot purchase a separate plan. So you need to make sure if you need that prescription drug coverage that you're finding a Medicare Advantage plan that's going to include that prescription drug coverage. Okay, so these are the two different options. It's important to note as well with a Medicare Advantage plan, you can't purchase a Medigap policy. Medigap policies are only for Original Medicare. Okay. So that's kind of an overview of the two different options for Medicare coverage. So when you're looking at making changes, these are your two different options. Okay. Of course, within Medicare Advantage plans, there's lots of different options. As I mentioned, there's over 100 different Medicare Advantage plans in Minnesota. And what works best for somebody else might not work best for you. So it's very important to do some research, do, review of those plans and figure out what's going to work best for your situation. Okay. So in 2023, these are the things that can change. As I mentioned, we do not have the 2023 premiums and deductibles for these two parts of Medicare yet. But you're going to see most likely, I heard whispers of possibly a lower premium for Medicare Part B, but I can't say anything for sure because I don't know yet. I think that would be great because if you were on Medicare last year, you know that the premium jumped up quite a bit. So that would be great. We'll cross our fingers for that. But we do know that these are the things that we will see a change in 2023. For Part A, most people do not pay a premium for Part A. So premium free, it goes by Social Security credits. So if you have enough credits, usually it's about 40 work credits, you do not pay that premium for Part A. If you do not have those credits, you are going to pay a premium, and that can be pretty steep. Right now, I believe the highest premium is over $400 a month. Okay, so it's a pretty steep premium. And so we're going to see, I'm going to go to my next slide here. We're going to see, hopefully we'll be able to fill in these blanks pretty soon for the original Medicare costs. Again, that QR code, and if anybody needs me to, I can show that at the end again, if you'd like to scan that and be on our list to send you those updates as soon as we get them. Just so you know, right now, the hospital deductible for 2022, gosh, I'm losing what year it is. I think I'm just still so shocked. It's almost 2023. That is, most likely going to go up as well. No, I'm getting too far ahead. And the monthly premium for 2022 right now is $170.10. So we'll see what that is for 2023. Okay. Okay, so we do know, however, that there are things that are coming for 2023. There's been several important pieces of legislation that will positively impact people on Medicare starting in 2023. So we like positive changes. That's great. The first thing is the Consolidated Appropriations Act, or it's also referred to as CAA. It was formerly known as the Benny's Act, so BENE. So if you were familiar with that at all, it's now called Consolidated Appropriations Act. It's intended to simplify the Medicare Part B enrollment process, provide advance notification of Medicare entitlement, extend coverage for immunosuppressive drugs for people eligible for Medicare because of end-stage renal disease, and it expands access to mental health services through telehealth. I'm going to just walk through each of these pieces just really briefly to help understand that a little bit better. So starting in 2023, Medicare will start earlier for some people. So right now, and if you remember, if you are already enrolled in Medicare and you remember your enrollment process, your initial enrollment period is the 7-month period surrounding your 65th birthday. During that time, if you enrolled any of the 3 months following your 65th birthday month, your coverage was pretty delayed. So it could be delayed up to 6 months for your coverage to begin. Excuse me. Now it's going to take away the delay in coverage, and the month that you enroll, your coverage is going to begin the month following. Okay. So this is mostly going to affect people who are first enrolling in Medicare, who are just becoming eligible. And it's also going to affect people who need to enroll during the general enrollment period. So as of right now, when you enroll during the general enrollment period, you can enroll anytime January 1st through March 31st. your coverage is going to be delayed until July 1st. Starting in 2023, your coverage is going to begin the first day of the month after the month you enrolled. Okay. So what you can take out of this is Medicare is taking away that delay in the coverage beginning. Okay. There are also, because of this act, also several new special enrollment periods that are being added for people who did not enroll in Medicare when they were first eligible, but they were impacted by circumstances beyond their control. So typically, when you do not enroll, when you're first eligible and you don't have any other creditable coverage, you're going to incur a penalty on your Part B premium. What this act does, it allows for special enrollment periods due to circumstances beyond your control. So whether it was somebody who was impacted by an emergency or disaster, a health plan or employer error that constitutes material misrepresentation of information related to enrolling in Medicare timely. So sometimes, we may think that we have creditable coverage through an employer, and maybe it turns out it wasn't creditable and there was some misrepresentation there. You could be eligible for a special enrollment period. You were formerly incarcerated, you're no longer eligible for medical assistance, or had other exceptional circumstances beyond your control. Okay, so this just allows for some more flexibility in terms of when you can enroll in Medicare without those premium penalties. I also mentioned there's a new immunosuppressive drug benefit. So currently, people who have had a successful kidney transplant while on Medicare lose their coverage for expensive immunosuppressive drugs after 36 months. And as a part of this Consolidated Appropriations Act, starting January 1st of 2023, people who have a kidney transplant while on Medicare will be allowed to continue coverage for those drugs under a new Part B ID benefit. So more letters to our alphabet here. But no other Part B benefits are included. People cannot enroll in Medicare Part D, and there will be no late enrollment penalty for delaying enrollment. And then the last part of this act was access to mental health telehealth services. So regardless of where people live, they will be able to access mental health services through telehealth. And this will apply to services provided on or after the end of the COVID public health emergency. Okay, I'm going to stop there just for a second. We're going to move on to Medicare Part D. Were there any questions? And I know, yeah, Anne wanted to make sure if you have questions, I think.
Go ahead.
Okay, so we're going to move on to Part D. So Part D is our prescription drug plans. Now, I do want to do kind of a little overview of the Medicare Part D plan because Medicare Part D plans are kind of like Medicare Advantage plans where each plan is very different. Each plan can charge their own premiums and deductibles. We don't know the information for 2023 yet in terms of what the ranges are for these premiums and deductibles, but I can tell you in 2022, so this year, the deductible cannot exceed $480. So right now, prescription drug plans don't have to have deductibles, so that deductible can be anywhere from $0 to $480 in 2022. And the range of premiums for these plans right now is the lowest being $6.80 to the highest being a little over $116. Okay, so there's a pretty wide range of prescription drug plans. And to figure out your specific cost for a Part D plan, my best advice is to use Medicare.gov. They have a plan finder tool where you can actually put in your prescription drugs, and it will come up with some comparison of different Part D plans that cover your prescription drugs and at what level they're covered. So each Part D plan has what's called a formulary of drugs that they cover, and they group those into different tiers. And based on what tier that drug is on within that plan is going to determine the cost of the drug. And it's quite the process. And what can happen is a prescription drug that you take could be covered under 2 different Part D plans. But on one plan, it could be in a higher tier than the other plan, right? So you might be paying more in one plan for the same prescription drug that would be covered under another one. So that this plan finder on Medicare.gov is a really great tool in comparing those so that you can see kind of the differences in the cost within different plans. The plan finder tool also shows you which pharmacies you can get these drugs at, and sometimes the costs vary at different pharmacies as well. So this really kind of gives you a better picture of what your cost is going to be for a Part D prescription drug plan. As we kind of look at how your payment works for your payment and your cost works for Medicare Part D, we use phases. Okay, so I'm going to show you a little graph here. You can see that first part. Now, this is looking at the 2022 benefit because we do not know these numbers for 2023 yet. I do know that last year for 2022, these numbers did not go up significantly, so we'll see what happens this year, but a slight increase is pretty typical. So you can see that first phase there is the deductible phase. So that's where you're going to meet your deductible. And once that deductible is met, you're going to enter the initial coverage phase, where depending on your plan, you're going to pay 25% or less of your drug costs. And once you reach, for 2022, $4,430, and that includes what you pay and what the plan pays, you're going to reach the coverage gap phase. And this is where now you're going to pay 25%. So no matter what you were paying before, you're going to pay 25%. So most likely your drug costs are going to go up at this time. Once you reach $7,050, you reach the catastrophic coverage phase, where then your drug costs are going to go down and you're going to pay a copay or 5% of your drug costs, whichever is greater. Now, we do know, drug costs are expensive and there is help available. So I do want to point out that there is, through the Social Security Administration, there is a low income subsidy benefit that people can apply for. So this full extra help benefit is for people who are in medical assistance, Medicare savings program, supplemental security income, and based on your income, you'll be placed at a different level of help with this one. I do know starting in, I don't think it's 2023, I think we'll talk about this a little later on, this full extra help is going to be expanded to cover more people, not just those who are deemed eligible if they're on a certain assistance program. Right now, for people who are not on any other type of program, there is partial extra help available. Now, this is based on your income and your assets. So you can apply for this partial extra help, and it's going to lower your premiums, lower your deductibles, lower your drug costs overall. Okay, so this is something you can apply for through Social Security. And, it's an underutilized benefit. Right now there are tens of thousands of people who are eligible for this program and they have not applied, either because they don't know about it or they don't think they're eligible. So I always say, if you think you might be eligible, go for it, because you never know. And the worst that can happen is that you're not eligible. So it's a pretty easy process to apply. You get your results, your eligibility determination in about 2 weeks. So it's pretty simple. If you need help with the process, you can call Senior Linkage Line and we can help you with this process as well. All right. So for 2023, so we know that, again, Part D plans can make annual plan changes, which can include those changes in premiums, cost sharing, network pharmacies, restrictions, and different plan options. But because of new rules and recent legislation, so you might have heard some stuff in the news about prescription drug Part D plans. You're also going to see some changes in 2023 that will improve coverage and lower costs for people who have a Medicare Part D plan. These changes include out-of-pocket costs will be lowered for some people. Discounts that were previously passed on to the pharmaceutical companies will be passed on to consumers. Tools will be available to help with pricing transparency. So right now, I mentioned that Medicare.gov plan finder, plans are going to be required to have cost comparison tools available for you so that you can better understand the cost of the drugs under their plan. And then cost sharing for vaccines will be covered under Part D, and that includes, the cost sharing for vaccines will be eliminated, and that includes the shingles vaccine. Okay, so some good changes coming up for Part D. We also know that for Part D, companies are going to be able to negotiate drug prices with network pharmacies. Some pharmacy contracts allow for even lower reimbursement based on certain performance measures that are not determined at the time of the sale. Basically, just means that, hopefully the cost of our prescription drugs will be lowered, okay? Starting January 1st, 2023, Part D plans will be required to apply all price discounts they receive from network pharmacies to the negotiated price. This will allow people to share in the savings and reduce their out-of-pocket costs. I mentioned this, the comparison tool. So, the tool for these Part D plans will allow people to have access to real-time formulary information. So again, seeing what drugs are covered under each plan and what tier they're placed on. It's going to get information out about lower cost alternative drugs. So sometimes, some drug may be less expensive, and it's going to have some transparency about that so that you can choose the lower cost option if that is something you so choose. This tool will also help you find out in advance what you're going to pay for your Part D plan. And that's something that's lacking right now in the Part D plan. Sometimes it's kind of a mystery what we're going to end up paying for our prescription drugs. Okay. So another very important piece of legislation is the Inflation Reduction Act of 2022. This is something that passed very recently. So it was passed into law on August 16th, 2022. And it includes several provisions that will reduce drug costs for people on Medicare Part D. It's important to understand that for this act, some things are going to be happening in 2023, but some things are delayed and they will be happening over the next few years, okay? I do have a timeline that I can share with you to help you kind of understand how that will work, but not everything is going into effect starting January 1st, 2023. So some of the things that are going to be changing because of this Inflation Reduction Act, out-of-pocket costs for insulin are going to be capped at $35 a month. So this is something that kind of started over the last couple of years. There were some senior savings plans that allowed Part D plans to only pay or only charge $35 a month for insulin. Now those out-of-pocket costs are going to be capped at $35 a month for all plans. The elimination of cost sharing for adult vaccines. So we talked about that. That includes shingles. It requires drug manufacturers to pay the government rebates if Part B or Part D drug prices increase faster than the rate of inflation. Okay. And it delays the implementation of the rebate rule. So this was a Trump administration rule that would have eliminated rebates negotiated between drug manufacturers and pharmacy benefit managers or health plan sponsors in Medicare Part D. So it's going to delay that. And we will see, in terms of if that's going to come to fruition later on. As I mentioned, some of these things will be delayed. So you can see here, January 2024. So they have a plan for when all this will go into effect. So we know that January 2024, we're going to see the 5% coinsurance eliminated. So once you reach that catastrophic coverage, as I showed you in that picture before, there's going to be no coinsurance. It's also going to limit the premium growth to no more than 6% through 2029. So we know that premiums for Part D plans can grow no more than 6% all the way through 2029. It's going to expand income eligibility for the full extra help. So I mentioned that more people are going to be able to have access to that full extra help through Social Security. It's going to put a cap on Medicare Part D out-of-pocket costs. That's starting in 2025 at $2,000 per year. And then in 2026, the federal government is going to be able to negotiate prices of some Part B and D drugs. Okay, to give you sometimes a visual helps understand a little bit better. So here's a little timeline that shows how the Inflation Reduction Act is going to work. So this is everything that we just talked about, just shows it in a nice little picture here. Okay, I'm going to move on to our next, unless there are any burning questions, I'm going to move on to our Medicare health plans, and I can ask for questions at the end.
Great.
So yeah, if that works for everybody, I think we'll just keep on moving on. So the Medicare health plans, as I mentioned, are the Medicare Advantage or Part C plans, or the cost plans. So those are both under Medicare health plans. Just a little bit more about Medicare Advantage plans. So these are offered by private insurance companies that assume the Medicare benefit for the enrollee. So as I mentioned, once you enroll in a Medicare Advantage plan, they become the payer of your services. Original Medicare no longer pays. However, you will still be paying the premium for Medicare Part B and the premium for a Medicare Advantage plan. Premiums range. There's a range, just like Part D plans. There's a range of premiums for Medicare Advantage plans. They can choose their own premiums. They must, though, cover all Medicare services and follow all Medicare rules, but they can then offer additional benefits, as I mentioned as well. If you have a Medicare Advantage plan, once open enrollment comes around, it's very important for you to read the information that comes from your plan. I mentioned this at the beginning of the presentation, but I'll mention it again. When open enrollment comes around, you want to review any information that comes from your plan very carefully, okay? All right, we talked about the annual open enrollment period from October 15th through December 7th, but there's also another enrollment period that I want to cover, okay? This is a relatively recent enrollment period. It started in 2019, and this gives you an additional opportunity to make changes in your plan if you start the year on a Medicare Advantage plan. You have from January 1st to March 31st of each year to make any additional changes. Now with this one, I give the example of, let's say during open enrollment, you were on original Medicare and you decided you wanted to try a Medicare Advantage plan. You enrolled in a Medicare Advantage plan and January 1st begins, your plan begins, and you go to make an appointment with your doctor and find out your primary care provider is not in the provider network, okay? If that's something that's important to you, you have the opportunity right now during this Medicare Advantage open enrollment period to find a Medicare Advantage plan that does include your provider so that you can switch to be able to make sure that your services with your primary care provider are going to be covered under your plan. Okay, so that's why you might want to use this Medicare Advantage open enrollment period. Again, you have to start the year though on a Medicare Advantage plan. When you enroll, so if you enroll in or make that change in January, your coverage will then begin February 1st. In February, if you make that change, it will begin March 1st and so on. So March, April 1st. So another opportunity to make some changes. All right, so I want to talk briefly about some marketing changes that are coming up for Medicare because first of all, I know that especially when we get into the open enrollment season, we start getting lots of marketing about Medicare Advantage plans. We get postcards in the mail. We see ads on TV. Sometimes we even see tables set up in the grocery store.
Hi, I am listening to a Medicare enrollment thing.
I think you're off
supposed
mute.
To be
Ann.
done in the next 5 minutes.
Oh, and I think you're off of mute. There we go. Perfect. So we know that we get all sorts of
Sorry.
That's okay. Regarding Medicare Advantage plans. And a lot of times it's telling us that we need to buy this plan and it'll save us lots of money, right? But a lot of times there's that really small print saying that they're not affiliated with Medicare, right? So we need to be careful with the marketing that we see around Medicare Advantage plans. There's been a lot of complaints about the marketing of Medicare Advantage plans and Part D plans. So in starting in January 2023, there's a new disclaimer that's going to be required when these companies market their plans. And companies must also provide additional oversight. Now, I'm not exactly sure what that means, but hopefully we're going to be seeing a difference in how these companies market their Medicare Advantage plans. Because usually what happens is they're trying to get you to purchase a specific plan because they have financial gain in you purchasing that plan, not because it might be the best plan for you. Okay. All right. So these are also due to the marketing. So anybody that markets their Medicare Advantage plan, they have to show they have a sufficient network of contracted providers. They can show a letter of intent, but they have to have that contract in place. So basically just kind of solidifying those standards around Medicare Advantage plans. Okay, we are almost there. Thanks for hanging in with me. I just want to mention a change in Medicare cost plans. So as I mentioned before, cost plans are only available in 21 counties in Minnesota. I'm going to show you the map here. These are the 21 counties that cost plans are available. Those same 21 counties are going to have cost plans available in 2023, except for Health Partners. Health Partners will no longer be offering cost plans at all. So if you're somebody who has a cost plan with Health Partners, you'll be given a special enrollment period in order to be able to switch out of the Health Partners cost plan. It is important to know, though, that if you do not make a switch, if you don't decide a different plan, Health Partners is going to automatically place you in a different plan. So that is something you want to be aware of, because who knows what plan they will choose for you. I think it's just going to be randomly assigned. So you want to make sure that you make the choice of what plan you want to enroll in. This is the Medicare Plan Finder tool that I mentioned. It has some improvements again this year. I think every year they try to kind of make improvements and make sure that everything is working well for people who are using this tool. If you don't have a computer or you don't like using the computer, you can call Senior Linkage Line and we will help you out with this Plan Finder tool. And one last thing, I always like to give a little disclaimer about Medicare fraud. Just be careful. If anybody calls you and says they are from Medicare, you want to hang up the phone. If somebody is trying to get in touch with you from your Medicare plan, they will send information in the mail. If anybody is calling asking for a Medicare number, if you don't know who it is or you don't know the reason, do not give your Medicare number. Just be aware that unfortunately there is a lot of fraud and scams out there, and you want to make sure to protect your information. So I always like to give that little disclaimer because unfortunately that is something we deal with, especially when it comes to Medicare.
So unfortunate.
It really is. Yes, it really is. So that is what I got for you today. The Senior Linkage Line, again, is a really great resource. Unbiased, free information and assistance. That number is there. Again, you'll be getting these slides, so you'll have these numbers and these websites. But please feel free to give us a call if you ever need help or have any questions. Now, if we have some time, I'm happy to answer questions if anybody has them.
Hey, before we do that, I just want to say to the folks in South Dakota, we also have the equivalent in South Dakota and North Dakota on our website, and I will send those out to you after this.
Perfect.
Go ahead.
Yeah, so in terms of, the Part D plans and the drugs they cover under their formulary, and this is in regards to new prescription drugs, you'd want to contact your Part D plan. So you want to contact the plan directly to find out in terms of what they're going to cover. Each plan, unfortunately, it varies from plan to plan. So there's no real standard within Part D plans of what they cover and at what cost. And so for something like that, you'd want to contact your plan directly to ask them about that.